Greetings, everyone. Happy day. It's almost Christmas. I hope you're having a wonderful, wonderful time now that we've actually officially begun winter. And I am having a really awesome day. I'm glad I did my get out and go do my errands earlier because it's almost like an ice storm with lots and lots of wind. And having moved to Northeast Minnesota as a 42-year-old woman, I was like, oh my God, these storms really frightened me. I'm thankful that I don't have to be out in it because if you can see a little bit of it through the windows, it is blowing, just blowing. Let's see if I can aim it. There we go. Just blowing like crazy. I was also equally frightened by the thunder and the lightning storms because we didn't have anything like that in Santa Cruz, California, not even remotely similar. They're so powerful. But I've actually come to a place where I really like that. I feel the energy in the air and it feels really good to me. As long as I'm not having to be outside, it feels pretty comfortable as long as you're inside and you can have things going like my little oil lamp over here. And that's going to be the hot tip before we dig into women and our moon cycles. We've been familiar with calling them our period. And a lot of women are really suffering today. They're suffering with something called Pcos. There's these diagnosis codes again: polycystic ovarian syndrome, or with a D on the end, it's a disease. Also endometriosis, where we've got excess tissue growing on the outside of the uterus, and it may start to actually even cover some of the internal gynecological organs, the sexual organs. We've got PMS, which pretty much everyone knows, even the guys who have been in relationships or grown up with mom in the house and sisters, is premenstrual syndrome. And we also have, premenstrual dysphoric disorders, and we could just keep going. But really what's happening is that we're living a life that's become out of balance. And 2020 was the year that showed us just that. Before we start, I got the hot tip. I'm going to show you my oil lamp. It's literally right behind me here. This is a hot tip I want to tell you about. They are $13.99 at Ace Hardware. They are not difficult to use. You're going to take the oil, which is not kerosene, although you could use that. But inside the house, I'm going to use a clean burning oil. You can see it here in the bottom. And you can see that if I turn it around a little bit, and I don't want to spill my glass on the top, drop my glass, there's a wick here. And when you buy more of that wick, it's about $2.99 for the wick material itself, also at Ace Hardware, but you could probably find them at Walmart and other places. We had a lag again. This little top piece, which is now getting hot. So the dual benefit of something like this, the grid goes down, the power goes out, you've got light. Okay, but the dual benefit is that it also produces some heat. So it's quite simple. You're just going to pull the glass piece off when you first buy it. These legs might be kind of tight. Just adjust them a little bit if you need to move them out. Fill up your little base by pulling the silver piece off entirely. It pops right off. Put your oil in there, your clean burning oil, which I'm going to show you, $7.99 for a bottle. Your extra wick is $2.99. And the entire light itself is $13.99. You got your little finger hole, and they also have metal ones. So this is kind of my hot tip of the day for you, is especially during the winter when there could be power outages. And I'll show you the oil here in just a moment. Having a cozy indoor day. This is the ultra pure oil, which is $7.99 or $17.99 for even the bigger one. I'm going to say that I've used not even a fourth of it. And I've been burning my oil burning lamp there for a couple of days off and on. So I'm going to go get a bigger bottle because I've got a nice coupon to use for $5 off at Ace Hardware. $5 off of $25. So I'm going to get a bigger bottle and some wicks. And then I'll have that good and stocked up. Okay. So I want to talk a little bit about female issues because women are, having a lot of issues that could be avoided. And We're not really passing down from the grandmothers to the mothers to the daughters. What we need to do about this, and now we're just singularly, it seems, for most of us, going into the gynecologist, or we try to find our way into Yoni Steams, which is beautiful and it's great, but it may not entirely heal you. It might be very, very beneficial, but you may have something more complex now that it may not entirely heal you. So there are therapies and treatments that feel good, that do produce change, but they might not be everything that you need so that you can actually feel better and that you actually heal. Now, there's a difference between going in and getting an ablation, a hysterectomy, breast removal, cut them off, get rid of them, taking drugs, especially chemotherapeutic drugs like tamoxifen, other drugs like metformin that we typically used to only use for diabetes because it deals with the pancreas and it deals with insulin. And now, true to track record, more and more people are saying, wait a minute, I don't think we want to do that. But they don't really know exactly what to do, because now you've gone from something that was very simple when you were a little girl that's becoming more and more complex and potentially even more and more infected, more and more mutation in that area, more and more infection, more and more, a deeper level of a problem. So let's dig in. We have PCOS, which is actually cysts. Poly means many, right? More than one or two. Cysts. Cysts are fatty little, bumps, kind of like acne, kind of like a fatty little tumor that's not cancerous at all. A cyst is a sac of pus, really. It's a sac of pus, mucus, phlegm. And it also indicates that there's congestion, that energy is congealed, it's getting stuck. In Chinese medicine, they would say, there's either too much of this or too much of that element, depending on the individual, because again, we're going to look at individual biochemistry. So a lot of women go to acupuncture to kind of move some of the energy meridians, which is beautiful and beneficial, like Yoni Steaming, beautiful and beneficial, and it may not completely heal you, especially if you've got some really condensed cysts. And the other is fibroids. So you've got the uterus, where, it's like a big muscle where baby is going to be, the gestation of baby, and baby's going to grow, the fetus, the embryo, the fetus, the blastocyst, the embryo, the fetus, the baby, until birth, is going to be housed in the womb, the uterus. And fibroids can start to grow in the uterine wall and in various places in the womb. They're called different names, submucosal and all different types of fibroids, but they're all essentially the same, which is fibrous, having fibers to it, fibrous material that's growing inside of the womb. So now you either go in and you have them, exercised, cut out. You have a hysterectomy and, take the womb out and get rid of the bad body part, which has been done to millions and millions and millions of women. Or we really take a thorough personal assessment of ourselves, someone helping us to make this assessment, but it needs to be a very thorough assessment, which has to deal with mind body, because everything that you are thinking on a daily basis, as you are thinking, if you're in a relationship or a relationship and a job, or a relationship and a job and having problems with parents, having problems with in-laws, having problems with the mask is just suffocating me and I don't feel right wearing it. It's causing me anxiety and panic and mask knee, acne around the mask area, congestion. These stressful thoughts will show up in many of the words that you use. And this is why I called my course Crucial Keys, because the words and the body language, once you really learn to become a reader of sorts in a different way than just listening to the transfer of words and interpreting it as you feel fit, you're listening with a different type of an ear directly for this individual. So you are honoring them at a much higher level to hear. And I'll give you an example. I have clients that say, I really feel like I've just been trapped with this whole thing and I really want to get out of this. And over, I start to hear that the word sound that they're using when they describe their situation that they're in, male or female, that they're in, eventually I can start to hear a pattern, and I will ask, if not the first session, because that's kind of getting to figure out what's going on in a consult, but second, third, fourth, or down the line, I will say, I was hearing you say this, and it made me wonder about these things, right? And this is where you need to blend in the mind-body. For example, I've got a testimonial on my website with Brian Marshall, who's a local pastor, or was, in Duluth, Minnesota, on the range, who lived in Duluth, Minnesota, who had psoriasis on his body, 85% of his body red and peeling, for over 31 years. He was retired from the church for it. He had to sit in a chair. And he's a written testimonial on my website at Naturally with Karen. We removed the majority of Brian's psoriasis, totally gone. First time ever. No creams, no potions, no diet changes, no hair tissue testing. I was getting to that. But Brian said, I can take it from here. Okay, great. I work for you. You don't work for me. I work for you. And so I said, sounds like a plan. You know where I am. But in about 8 or so sessions of actually mind-body medicine. So Brian is one instance where I like to bring up because we only did mind-body. And in doing mind-body work, which is so powerful, once you have really developed an expertise in it, and it takes time, it takes energy, it takes focus, but it's so worth it. And this is why I've got 5.5 hours of content, from a little bit of snippet about the history, why it was kind of put on the shelf and sequestered away so you don't even really know about it anymore, and how powerful it is. And everyone that's taken my course, which comes with a certificate of completion at the end if you want one, beautiful in color, has said, whoa, this has completely changed my life, because there's no way you won't use it again with your friends, your family, yourself, for sure. But it's going to be a big, big tool when it comes to female gynecological issues related to the womb and all the sexual organs, the breasts, the uterus, the fallopian tubes, the ovaries, the monthly moon cycle that we call a period, or menses, menstrual cycle. I am a woman who went through being raised by a grandmother who said, we don't use the doctor and we don't want to do the drugging, cutting it out system. And still, in my early 20s, I'm going to say I fell for going into the gynecologist. And therein, I was diagnosed with cervical dysplasia. I was treated with cryosurgery, which is freezing bad cells off of my cervix, cauterization, burning bad cells off of the surface of my cervix. Cervix is, where you've got to have the sperm go in to impregnate a female. It's got to go in through the cervix. And so when you get a pap smear at your gynecologist office, they're taking a swab and they're swabbing to get these cells. And then the cells are being looked at in a lab under a microscope to determine whether or not the cells have any abnormalities. But yet when I ended up working in law firms for almost 20 years, being a legal secretary until being a very experienced senior paralegal in Silicon Valley in San Jose, California, almost every woman in almost every firm I'd worked in had been pushed through the same racket. And I'm going to call it a racket because I couldn't believe the numbers of women that had been through it. So I could have spared myself if I would have had women like myself that had experienced this, had known better, like Dr. Sabi, had realized that maybe these were not something that was going to serve me to my highest good like I wanted. So when you've got cyst, mucus-filled, pus-filled sacs on the ovaries, these two beautiful ovaries that are going to pump out the seeds of life for you, that are going to be responsible for these monthly moon cycles that you have, these two ovaries. You need your ovaries to be working efficiently and not be clouded. That's why we talk about, well, the weather's not so nice today. It's just cloudy and yucky and it's just ugly, right? We describe the weather almost like we describe our moods. Yeah, it's really nice out today, which means it's sunny, it feels pleasant, right? It feels good. Now, endometriosis, where we've got tissue growing on the outside of the womb, we've got tissue that starts to back up. We used to, although people dispute this today, we used to call endometriosis retrograde menses, meaning that we believed that it was a backing up of the menstrual flow into the body. And it would actually chocolacize, would turn the cyst and the ovaries would be covered with this dried blood, which they would call chocolate. You know, the ovaries had become very chocolate and chocolate cyst on them, which is just dried, stagnant blood. It turned brown. It was oxidized. There's PMS. There's all of this hormonal, pain and, vaginal pain and just monthly pain that comes along with, and the mood changes and the temperature changes and the raucous personality changes that comes along with pre-menstrual, pre-moon cycle tension. That doesn't have to be the case. Because when we do your hair tissue testing, we can find out those elements that build your estrogen, those elements that build your progesterone, those elements that build your testosterone for women and men. How are you going to get someone pregnant? Add to the men who are listening, if your zinc levels are super deficient, right? How are you going to keep your body at a temperature where you're going to have fertile sperm, healthy, viable sperm, if in fact your body is so out of balance, your blood pressure is whacked, your body temperature is whacked, your energy is whacked? The same way we describe the weather as nice or, oh, it's just ugly out, it's just crappy. The same way, we describe many other things. And so we have learned from a system of over 100 years that we'll just go to the doctor, we'll go do some testing, and we'll find out, we'll know now. Now we will know what's going on with us. But people are starting to get a little soured about more testing and getting in the big magnet machine and scanning. And we've got a new drug out. You want to try the new drug? We've got a new procedure for that, right? And I don't think that it's all, as a result, it's all offered to you in the spirit of malice. But I do think that it's done in the spirit of ignorance. And so if you have cyst on your ovaries, we won't even go into PCOS and PCOD. You've got cyst on your ovaries. You've got excess tissue around your uterus, your womb. You're not getting pregnant. You're definitely worried, or you've got confirmation that you've got infertility issues. You've got PMS and you just go into terrible moods and pain and you just feel horrible. And first it was taking over a week of your life. Now it's taking over 2 weeks of your life. And now 3 weeks of your life is all about preparing for this terrible time. I know. The cervical dysplasia, the cryosurgery, the cauterization to my cervix, the going in and having the other procedures done that never, ever now, in retrospect, needed to be done. Okay? Forming fibroids, having endometriosis, being told that I was going to be infertile. I overcame these things and I suffered from these things both. And in that, I learned a great deal. And in the last 25 years of my 37 in particular, 25 of my 37, in doing wellness work, in learning how the body, what it needs, how it forms these through stagnation, mind, body, elements that are off balance, you wouldn't go to the auto parts store, Napa or AutoZone or any of these, Kragen, California, or any of these auto parts stores and say, well, I think I need fuse number C2 and 5-4 and D2 and EF. I need those fuses given to me. I think I'm just kind of going to guess, right? And you open up the fuse box and you check to see which ones are burnt out on your car, because now you have several things that aren't working on your car, which is a vehicle, just like your body's a vehicle. You wouldn't guess about that. Well, maybe some of us would. I'm not very mechanical, but my specialty is helping people to get comfortable in their bodies again, the natural way. So it would be better if you opened up the hood or opened up the door of your car, depending on where your fuse box is. You pulled out the owner's manual to your car so you knew what you were dealing with. And he said, okay, wait a minute. It looks like these 4, when I pull them out, are the ones that are burned out. So I need to go to AutoZone or Kragen or whatever you do, Napa, and I'm going to go and get these 4 fuses, and I'm going to put these 4 fuses. I think we just heard a stormy, snowy window in Pablo's wondering what's happening. And you would go get those 4 exact fuses. And this is what it's like when I look at your hair tissue test and I say, I see, just like I did for Viata. Okay, your copper is at a 7.7, and ideally, we wanted it about a 2.5, okay? Copper builds your estrogen, all right? Copper builds other neurotransmitters that are very important for you, because that has a lot to do with all day long, you're getting bombarded with notifications and pings and dings and YouTube. Oh, my favorite YouTuber just ping, Facebook, ping, ping, ping. Someone just liked your this or your that. And all day long, you walk outside and it's like ding, ding, da ding, 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 ding. Cars are locking and unlocking and alarms are going off and, walk lights are going and you can hear it for, some of them have the sound, walk, they used to. And you're just living in this bombardment of noise pollution especially when you live in a big city. So it's nice to take some quiet time. And this is what I got mandatory lessons moving to Northeast Minnesota is my windows are all frosting up like you would see on Christmas images. But I lived in California and I never lived around snow. A storm like this, everyone kind of battens the hatches, comes inside for warm, hot cacao and, just quiet candles going and oil lamps and blankies and reading and watching a cool show that you wanted to watch, actually having conversation with loved ones. When the weather's nice, we're back outside and doing our walking and moving that stagnation. We're getting a little bit more sleep and rest, mental rest, energetic rest, emotional rest. During the winter, we look forward to the season of coming in. Those cysts on your ovaries, that excess tissue and growth with endometriosis, that terrible time of PMS with moods and sometimes long elongated cycles where you're like, wait a minute, my cycle used to be like 5 days. And it might go one way or the other. It might be like now it's only 3 days and it's only coming every 3 months. What the heck? We know, well, I'll show you why. It might be that, my gosh, my cycle is now lasting 9, 10, 12 days and it's coming every 21 days. I'm bleeding and bleeding and bleeding, and I'm fearful that I may start going into anemia. I might start losing some of my hemoglobin. I might start losing some of my red blood cell count, and I might need to take a look at that. I might get anemic. Infertility. I feel for the women because I was told you're never going to have a baby. You're definitely infertile. You've definitely got endometriosis and it's not going to happen. And so this from Dr. Jose Bolaños in Los Gatos, California in 1993. My partner and I went, I set up the appointment. I was like, whoa, we're not getting pregnant. I'm getting really scared. 1993. I'd been cleaning my womb. It wasn't happening. Now, through the last 25 years, I've figured out through a series of assessments what's going on with this level and this level and this level and this level. What am I hearing on the mind-body level? What's going on the hair tissue test? What are your cycles, or how are they expressing themselves? Are they long? Are they short? Do they come often? Do you have a lot of clots? Do you have a lot of pain? Do you have mood changes? We can look at this. Some total individual biochemistry of just you. And by starting with your hair tissue test and the consult, I'm able to really start putting pieces together for you in a real way. Nobody wants the pain. Nobody wants to have to go in there and surgically be ablated, a cervical ablation, uterine ablation. Nobody wants to wonder if these cysts on their ovaries are going to potentially turn cancerous and go into ovarian cancer. It's slim, but it happens, okay? And it's going to happen with more frequency because we don't know what to do. I'm going to show you what to do so you can help yourself and you can become your own physician and learn to monitor some of the ways that I'm going to show you so that you will know what your body's communicating. Does this make sense? Okay. So I want to thank everyone who's joined me. I really appreciate that. I can see there's a lot of people here today. And also to be able to share that if we can get started with the hair tissue test, you can start the new year. Right now I'm doing this on December 23rd. It's a live stream event for you, specifically about the yoni, the womb, the uterus, the gynecological issues that women suffer from. And as a 59-year-old woman, I lost my child just a year and almost 2 months ago. And so I'm in a place of grief. I'm rebuilding myself physically from enormous shock and stress and adrenal fatigue. That doesn't change my medicine. It might change a little bit about how I deliver it. I might be not quite as stable as I always have been in terms of, some anxiety comes in. I miss them. I miss them terribly. But I learn every single time, what could I have done differently? And there's things that I learned that when he was 20 and 21, he died at age 24, physically died, transitioned at age 24. At age 20 and 21, I was like, wait a minute. I started seeing things about his thyroid. I hair tissue tested him in December of 2017. I saw where his copper levels, I saw where these other levels were. And I knew I got a certain amount of time, but then once a person is addicted and hijacked by opioids, it's almost too late because it's very difficult to say, can you take this every day when their lifestyle is not a calm, stable lifestyle? So sadly, we want to do what we can do for people, and sometimes we can't. What I want to do, and I want to emphasize in this particular live stream, is that if you haven't had children yet, if you're planning on having children in the future, like many of you will be, it is absolutely crucial, that you do this work and that you learn that what the health of your womb, the health of your body is going to be a download to your youth, okay? Your baby, your youth is going to be very significant in terms of how they're going to express. They're going to take on a good part and inherit a good part of your tissue mineral pattern. So, I hope this was very informative for you tonight. I have a very professional side. I have a side of me that's very down to earth and laid back. I have a side that's very kind and compassionate. I also have a side that really gets her hackles up and says, how could these things happen to our people? And gets a little angry, especially after you lose a child. And right now, being diagnosed myself with PTSD from 4 years of really trying to, help my son to get this thing off of his back. He was a victim. And so I look at addiction quite a bit different than maybe someone else who had not gone through that. And I understand that many who may be watching me are diagnosed bipolar. You may be pseudo-bipolar, and I will show you why. Through birth control and IUDs and everything else, they have affected you adversely. Maybe not even for you, but maybe even for mom. So many times I will say something when I'm actually observing someone and in a consultation with them individually, and I will say, I really need for you to get a hair tissue test for you and a consult for you and at least a hair tissue test for mom. So I can pull up that email report when it comes in about 2 weeks from the time I get the hair sample. And I'm able to show you and get going on helping you to fix the underpinnings of why your body isn't bringing you the results that you're not going to get singularly just from a bottle of supplements or just by changing your diet. It's not going to work. I've already tried. I've already been there. I've already been a 20 and a 30 something on this journey. Today, our soil does not have enough integrity to heal you unless you're living somewhere where Chinese farmers know about geomancy and they know about the land and they know about the proper nutrients. They've got a PhD in agriculture and nutrition and bioscience, and they know, or they have this ancestral knowledge moreover. And I have spoken with one man outside of Los Angeles whose family had been growing a particular type, which I won't say because I don't want to get him red flagged. But I had a conversation and he said, you probably don't know about this. And I was like, of course I do. He's like, wow. He said, I'm finishing my PhD right now. And he goes, my Chinese family has known about growing this for over 4,000 years. We've grown this particular food and we know to do these certain things about the land. And I said, I got a sample of your food. And when I put it in my hand, I felt a faint amount of electricity, which I have not felt since 1966 as a little girl with an apricot. I know that from 1966 until at that time, I think it was 2016, that I felt that. And I could not even eat those. So I dried them and I preserved them. And I have them with me to this day because at one time, I knew that at that time, that those were going to be future medicine. So thank you for joining me. I really appreciate it. And let's continue to build because there are many ways that we can remove the congestion, the congealing effects with these cysts, the pus-filled sacs on our ovaries, the excessive tissue. Actually, with endometriosis, you can actually also end up with what's called adhesions. So sticky tissue, fibrous tissue starts to adhere to the bowel, and that's where sometimes women go in for surgeries. And they didn't do work to cause the body to cleanse and get rid of this stuff, which works, not just an herb packet, not just a pack of herbs that you buy from someone off Facebook, but I'm talking about a total overall program from mind, body, hair tissue, herbs, dietary, to habits, and on and on. And that's the assessment I do. And it's not going to be delivered to you in one session. It's not going to always take 20 sessions, but you didn't get that way in one day or 1 year. This is accrued over a very long time. So the cyst, the adhesions, the extra tissue all around, the fibroid non-cancerous tumors, the pain, the mood disorders, the heavy flow, the big clots, huge clots that a lot of women have, huge, where they're bleeding into their pants all the time and it's embarrassing, it's frustrating, it's producing anemia. I have help for you and I guarantee it. You got to do what I mentioned that you need to do, which is very reasonable, but I have help for you. So you take good care and make it a wonderful evening. Thank you. I appreciate you joining me.